Good evening. My name is Dr. Adrian Talley, and I am the Superintendent of Indian Prairie School District. I would like to welcome you to our fifth Parent University COVID-19 vaccines. In tonight's presentation, we will cover some background on COVID-19 vaccines, who can get them, how to get them, and future developments. Thank you all to the parents who have submitted questions in advance of tonight's webinar. We look forward to getting your questions answered. And now I want to introduce the two local experts who are with us this evening. I'm excited to have them here to talk on this topic. Dr. Adam Schriedel is an internal medicine physician and chief medical officer of Edward Medical Group. Dr. Schriedel earned his medical degree from the University of Illinois at Chicago and completed his residency at Loyola University Medical Center. He is a member of the American College of Physicians and American Medical Association. Welcome, Dr. Schriedel.
Thank you, Dr. Talley.
We also have with us Dr. Jonathan Pinsky. Dr. Pinsky is an infectious disease specialist with Metro Infectious Disease Consultants and Medical Director of Infection Control and Prevention at Edward Hospital. Dr. Pinsky earned his medical degree from St. George's University School of Medicine and completed his residency and fellowship at Loyola University Medical Center. Welcome, Dr. Pinsky.
Thank you for having me.
We're glad to have both of you here tonight. So we have a lot of questions, so let's go ahead and get started about the current state of vaccines. Dr. Pinsky, you have some information to share with us on the vaccines that are available, vaccine safety, side effects, and the variants we are now seeing.
Yes, and I'm just going to share my screen for you, and we'll get started. Okay. Okay, here we go. So, can you see the PowerPoint okay?
Yes.
Perfect. Okay. So I'm going to go through a little summary, just about 15 minutes about COVID vaccines. So first question is, how do vaccines work? Well, we know that COVID-19 infection elicits an immune response. And that response is primarily driven by antibodies against what we call the spike protein of the virus. So the development of vaccines have focused on that spike protein. So there are different kinds of vaccine that all elicit antibodies against the spike protein. The mRNA vaccines contain mRNA that encodes for the virus, and it's in a lipid nanoparticle. And the way this works is the vaccine is injected, and then the mRNA is released into the cytoplasm of the muscle cells, and then this transcribes the spike protein, which in turn elicits an immune response. And then 3 or 4 weeks later, you get a booster dose. And when you get that booster dose, you get a second immune response with antibody levels that are 10 times higher than the original antibody levels you get from the primary vaccine. And the levels of those antibodies are even higher than you get from natural infection with COVID-19. So this is a breakdown of the types of vaccines for COVID-19. We have the two mRNA vaccines produced by Pfizer and Moderna. Those are the ones that are currently available for use in the United States. Then we have two vaccines that are derived from adenovirus. So this is very similar, but instead of the lipid nanoparticle delivering it, it's the nucleic acid is delivered in an adenovirus. This is actually a DNA virus, so it's DNA, not RNA that's delivered, but the end result is it produces spike protein and then elicits a similar antibody response. And finally, there's Novavax, which is a protein conjugate vaccine. And this vaccine actually contains the spike protein itself. Now, all but one of these vaccines are 2 doses. So you get a prime dose and then a booster dose 3 or 4 weeks later. The Janssen vaccine is actually a 1-dose vaccine. That's one of the adenovirus vector vaccine. And that vaccine is up for approval by the FDA later this month. So we'll be hearing more about that vaccine in the future. Okay. Oh boy. Hold on. Okay, a little bit about efficacy. Now, efficacy means how effective the vaccine did to prevent infection. So in the original trials, they looked at antibody responses. These trials, they look at how well it prevents infection. So the Moderna vaccine was given to 30,000 participants, and that has an efficacy of 94%, and the Pfizer has an efficacy of 95%. Now, up in the right-hand table, right-hand corner, there's a table that shows the breakdown of the numbers. So if we look at the Moderna vaccine, in the placebo group, now placebo means they didn't get the vaccine, they got a kind of a dummy. There was 185 COVID-19 infections, whereas those who got the vaccine, there were only 11. There were also 30 severe infections. By severe, it means these patients had illness beyond that was besides just a sore throat and fever. Maybe they were hospitalized. There was one case of a death. There were 2 people in the ICU. One was on a heart-lung machine. There were 12 people with low oxygen levels and a variety of severe medical conditions. So of those 30 people, they were all in the group that did not get vaccine. There were no severe cases in the vaccine group. Now, the Pfizer had very similar results. There was 162 patients in the placebo group that had infection, but only 8 in the vaccine group. There were 11 that were severe, 10 of which were in the placebo group. So there was one case in the Pfizer that was severe. That particular patient was categorized because of a low oxygen level, but that patient was not hospitalized. So in fact, there were no hospitalizations in any of those patients who got either the Moderna or the Pfizer vaccine. Okay, go to the next slide. Now, vaccine reactions. Now, one of the most common things we see with these vaccines are kind of the normal immune response to infection. These we don't really categorize as adverse. They are just kind of side effects of the immune response. So injection site pain and swelling is very common. That occurs in like 80 to 90% of people. You know, you maybe recall getting a tetanus shot in your arm was a little sore. That's what that is. So that's very common. And then fever also occurs, and this occurs more common with the second dose. So about, less than 1% of people got a fever with the first dose, but with the second dose, it was a lot more common. It was 17% if you were under 65. If you were over 65, it was less common, about 10%. And then chills and fever occur fairly commonly. Chills occurs 48% of the time if you were over 65, if you were under 65, and 30% if you were under 65. And those are normal immune responses. They don't cause any harm to the patient. Now, if you get that, you can take Tylenol as needed. It is actually not recommended to take Tylenol prophylactically or to prevent this because it actually can impair the immune response. So you want to wait until you actually get a fever and then you can take the Tylenol. Okay, safety. Well, everybody, this is what people are concerned about, safety. And this is why the trials required 2 months of safety data before they were released. So in this group, 30,000 in one, 40,000 in the other, there wasn't any major safety signals. There were no major adverse reactions that were linked to the vaccine. And what they do is they kind of list the patients who got the vaccine, who didn't get the vaccine, and they look at all the adverse reactions reported, and there was no difference side by side. Now, allergies are the one thing that has come out after this went to market, but these are also very rare. So, for example, with the Moderna vaccine, the first 4 million doses that were administered by January 21st, there were 10 cases. Now, I think it's 11 cases now of what they call anaphylaxis. This is a severe allergic reaction. If you look at the rate, though, 11 and 4 million, that comes out to about 2.5 per million participants. So that's very, very rare. I should note that since the vaccine is new, we are required to have patients stay for 15 minutes of observations in a medical setting. And I should also note that anaphylaxis generally occurs within that 15-minute time frame. There is one precaution, though. If you do have an allergy to an injectable medication, then it's recommended that you're observed for 30 minutes. And the last point is, think about safety. We think about the safety of getting the vaccine or not getting the vaccine. So, the risk of not getting the vaccine, getting COVID infection, hospitalization, death, compare that to the very rare risk of having anaphylaxis, for instance. So I give a comparison. is it safe to wear a seatbelt? It seems like a silly question, right? Because the seatbelts protect you, but that is very similar to me asking the question, is this vaccine safe? Is a seatbelt safe? Okay, a lot of questions about pregnancy. So new vaccines, they're never tried in pregnant people or immunocompromised people because these are new vaccines. I want to make sure they're safe before they're rolled out to the general population. So pregnancy was an exclusion criteria for the trials. However, there was a handful of people who became pregnant during the trials, and there was no safety issues. And I should note that since the vaccine went to market, there have been over 20,000 pregnant women that have gotten the vaccine, and so far there's no safety issues. The CDC says if you are pregnant, you can get the vaccine, but we just want you to have a discussion with your healthcare provider. But there's no precautions with pregnancy or lactation. Okay, how about children? So the Pfizer vaccine was tested in adults and then children down to the age of 16. So that actually is approved for those 16 and over. The Moderna one is 18 and over. They are now studying this, both of the vaccines for children 12 years and over. So those trials will be coming out soon. And I did hear that as time goes on, the age of these are going to kind of go down and down. So it may be by the fall and winter that these could be given to younger and younger children. Okay, a little bit about COVID variants, and this, maybe there's more questions about this later on, but what is a variant? A variant is a collection of mutations in the virus and that cause a change in its behavior. So the UK variant, they call the B.1.1.7 variant. This has a characteristic of being more transmissible. However, the antibodies neutralize this virus just as well as the native virus. So the vaccine should work just as well for this virus as the other viruses. The next one is the B.1.351 or the South African variant. Now this one is a little bit more concerning because these mutations actually impair the antibody response. And however, it was noted that vaccine-induced antibodies will still neutralize the virus, it's just not as strongly. And in the vaccine trials with Janssen, they actually tested this in South Africa and it was protective. It just wasn't as protective against this virus as other viruses. And the point that they're saying is that the more transmission there is of viruses, the more there's going to be replication and the more opportunity for mutations. Immunization is kind of our way to stall this process. If we can stop the transmission, we can stop the mutations, and then we're less likely to see variants. So I know I whizzed through that. I was 10 minutes, 15 minutes. Wow. Okay, so I'm ready for questions, Dr. Talley.
Dr. Pinsky, thank you so much. The information you gave was very illuminating, very helpful. I'm going to go to Dr. Schriedel right now to talk about receiving the vaccine. Who is currently eligible to get the vaccine?
Thanks, Dr. Talley. So we're following the guidelines set forth by the Illinois Department of Public Health, all healthcare systems, as well as some of the local pharmacies and some of the larger mass vaccination sites that are starting to run now are following these guidelines. So right now, 1A, which is frontline healthcare workers, as well as residents and staff of long-term care facilities. And in Illinois, that's about 800,000 people. And then we have our 1B, who are also eligible right now. That's your frontline essential workers and residents over the age of 65. And that also includes our essential workforce. So that would include first responders, K through 12 education workers, food and agriculture, manufacturing, corrections workers, postal service workers, public transit workers, grocery store workers, staff at shelters, daycares. That is, with that group, so we have about 1.3 million people over 65, and then an additional 1.9 million adults that fall into that essential worker category for 1B. So it's about 3 million people in Illinois. So those are our current eligible folks. However, Governor Pritzker did recently announce that he was going to expand that 1B to include some immunocompromised high-risk medical conditions as well for people that are under 65. And that may go into effect within the next 2 weeks, actually. So, so that'll be another group potentially that's eligible here shortly. And then we move into 1C, which is some additional essential workers, and then into phase 2, which is essentially everyone.
So we have seen that the vaccines are in short supply. What advice do you have for someone who's looking to get the vaccine?
Yeah, so there will be several outlets and potential outlets for people to get vaccine. So you have your primary care outlet through Edward Elmhurst Health or whatever health system you're associated with. So that would be one outlet for people. Healthcare systems are getting vaccine allocation. But my advice would be to sign up at other locations as well. So we have multiple pharmacies that have vaccine available, as well as some of our local counties, DuPage County, Will County. And I would look at those websites. They do have waiting lists forming on those websites. In addition, this is also being created at multiple pharmacies as well. It doesn't really matter where you get the vaccine. The vaccines that are available are the same. So, Pfizer, Moderna are currently available. You often won't have a choice as to which vaccine you may get. It really depends on allocation and supply. But as Dr. Pinsky stated, they're both safe and they are both as effective as each other. So that would be my advice.
And just one more question on this. As you mentioned, there are those who are falling group 1B or 1A. If you're in group 1B and you feel as if maybe you want to let someone else get ahead of you, what are the views about if you have the opportunity, should you get the vaccine or should you wait and let others go ahead of you?
My recommendation is that if it's your turn, get the vaccine. I think the more people we get it, the sooner the better. And I think the safer we all can be. And my recommendation would be that you're obviously being very thoughtful and doing your part from a public health perspective. But when it's your turn, you should get the vaccine.
Okay, thank you very much. Dr. Pinsky, in your presentation, you talked about the vaccine for children. Can you just illuminate some more about when do you think it may become available for children to have that vaccine?
Yeah, so I think they're doing the trials now for 12 and over. And unlike the large phase 3 trials, where they have to look at efficacy data and how well it prevents infection, now that they know the vaccine, they kind of have like the correlates of immunity. So they know that high antibody titers correlate with protection. They can more or less just look at the antibody titers and see if they look high, and then there's no major safety concerns that will move forward. So they're probably looking at, a few thousand, not 30,000. So I really don't know how long it would take, but, that's the process. And then once it gets approved to 12 and over, then they would kind of move it down. Maybe you could then go to like 8 and then 6, kind of, ratchet it down a little bit. So I think, it's very possible that by, the fall or winter, it may be more available to, all school age children. But I don't know exactly.
No, thank you very much. To either one of you, what is the process of making vaccines mandatory for school age? Do you think that this will be a requirement?
Well, right now, the availability of vaccines makes it almost impossible to require it. I think that the more people that get the vaccine, we have, 10% of Americans have gotten this vaccine, so we know it's safe. I think once it's more available, there could be discussions about having it mandatory. But but I don't think that's anything that's going to happen in the immediate future, but it's certainly possible.
I think, Dr. Talley, as we see that safety and efficacy data that Dr. Pinsky was talking about in children with these additional trials for kids, that will also, give us some peace of mind as far as moving forward with any sort of potential mandatory nature to the vaccine. But we don't have that data just yet, and it's coming, and I think it'll be helpful, certainly.
Yeah, I think it's unlikely that it'll be mandatory in the fall for sure, year or two. But in adults, it's different. It's given to a lot more adults, and it's possible that it may be mandatory in other, business settings and workplaces and things of that nature before it becomes, something that's mandatory for children in schools.
Thank you. So let's say someone has gotten the vaccine. What advice do both of you have on precautions that need to be taken even after you get the vaccine?
Right. So, let me give you measles for an example. So, someone could ask, like, is it safe? Are you more likely to get measles if you got vaccinated and you go to an area where measles is endemic, or if you're not vaccinated and you go to an area where there's no measles? You're actually more likely to get measles if you're vaccinated and you go to an area that has measles. That's because it's not 100% protective. So the vaccine's 95% protective. So as long as there's cases out there, there's still a risk of getting infected. So what we really need to wait for are for the cases to come down, and that'll probably come through vaccination and everything else we're doing, the masking and the social distancing and all these other efforts. And, when it gets to a point where it's just a very rare, it's very rare to get exposed, then we can think about kind of backing off the mitigation. The other thing is we don't really have an idea how well it protects against asymptomatic infection. We know it's 95% protective against symptomatic infection, but the studies are really not out there for the Moderna and the Pfizer trials. There are some other vaccines that have some data. There's looking at maybe 70% protective, but we don't really have that information. So, there really should be no change in the practices of masking and social distancing, even if you've had the vaccine.
Yeah, I think we'll get some of that transmission data as we move forward. But correct. In the meantime, continuing the mitigation techniques that we're using now, including masking and 6-foot distancing, is important for those reasons, because of the lack of the 100% effective vaccine and the lack of data regarding transmission. I know this is particularly of interest for school settings because that 6-foot distance can sometimes be difficult to maintain in that setting. But at this point, it is recommended to continue. We are continuing that in our hospital setting, as well as in our medical office settings as well, despite the majority of our staff having been vaccinated.
Interesting about hospitals maintaining that 6 feet of distance. I would imagine that's very difficult to do, but I also understand the purpose of why you do it, to help stop the spread. Very important.
Certainly, not in the presence of examining a patient or something like that, but outside of that, yes, we do, including our waiting areas and other things, to try and keep those people safe. We don't know who has what medical condition in that area, or who's been vaccinated and who has not.
Thank you. Dr. Pinsky, we've heard that Johnson & Johnson is in trials for a vaccine. What do you think we will see in the near future about increased availability or other manufacturers producing vaccines?
Yeah, Johnson & Johnson is just completed they have the preliminary results of their phase 3 trials. And so they've submitted an application to the FDA, and they're meeting, the Vaccine Advisory Committee is meeting on, I think, February 25th to discuss that. So if that moves forward, it may get approved at the end of the month. And that will help with the availability of vaccine. I heard there may be 300 million doses, I think. And But that one is one dose. So and the other thing is doesn't require the same refrigeration as the Pfizer and Moderna. But that will be helpful. Now, some may ask, and they've heard that it doesn't have the same efficacy level as the Moderna, and that is true. But they've reported 72% efficacy versus the Moderna, which is 95% efficacy. But the thing is, most people won't have a choice and say pick Moderna or pick Johnson and Johnson. Obviously, I would take the Moderna first if it's more efficacious. But really, it's a choice of having vaccine or no vaccine. So I'm looking at 72% efficacy or 0% efficacy because I haven't had the vaccine. So I'm going to take that Johnson and Johnson vaccine if it's available to me now, and then maybe as availability increases for other vaccines, you could still get the Moderna later on, perhaps. So it's definitely going to help the fight against COVID.
Yeah, I think in the next 2 months, we will see a significant improvement in availability.
Yeah.
And you can see it, locally as our pharmacies kind of ramp up, getting ready to help mass vaccinate, as well as our health systems and also county mass vaccination sites.
So sometimes people worry about whether they should get the flu shot and the COVID vaccine shot at the same time. How long should one wait between getting the regular flu shot and the COVID vaccine?
Right. So since the vaccine is new, they really want to watch the safety data. So for that reason, they want to make sure that any reaction to the vaccine is reported and characterized very well. So they want a 2-week gap between the COVID-19 vaccine and any other vaccine. So if you get the COVID-19 vaccine, you need to wait 2 more weeks before you get a flu shot.
I guess remember also that it's that these are 2-dose vaccines. So it's really kind of a 2 week prior to that first dose and also 2 weeks post the second dose. So it's really, almost a 6 to 8 week period.
And I don't want to discourage anyone from getting a flu shot, and everyone should get a flu shot, but we actually are not seeing any flu now. COVID-19 is the big threat. So, that should take priority well over a flu shot. So if you have a choice, you're up for a flu shot, but you think you might get that COVID-19 shot in the next couple of weeks, so maybe you want to wait.
Yeah, I've seen, I don't want to jinx myself here, but I've seen one
okay.
case of influenza.
I guess if you're in phase 2, so if you're a 30-year-old with no health problems, probably gonna be a few months before you get the COVID-19. You probably should get the flu shot.
That's a good point. Yeah. And I want to give kudos to our local community. I feel like people did come out early and get their flu vaccines early this year, which I think was one, helping fight flu, and then also reduces some of this complications when it comes to the COVID vaccine. And then in addition, the mitigation steps that we've taken to prevent COVID, I think, has been ultra protective for preventing influenza as well. That's been a good thing also.
Yeah, one interesting tidbit about flu is, we had a very busy flu season last year. It began in December, and it was just high flu levels all the way through the beginning of March. And then when the governor instituted the stay-at-home order, about 2 weeks after that, there was zero flu. It stopped.
It disappeared. Yeah,
and we haven't seen any flu since.
Well, one has to wonder if those mitigation techniques for flu season in the future, wearing masks might be something that may help with reducing it. Here's a question. If I'm vaccinated, can I still be a carrier of the virus?
Yeah, so I think I touched on that before. We don't have the full answer to that because the way it was studied against symptomatic infection. I'm sure that it reduces asymptomatic infection. There's really no number on it. AstraZeneca had some data that it was around 60 or 70% protective for their vaccine. So yeah, you can still get infected. We know, again, it's not 100% protective, so you can still get a symptomatic infection. You can still get asymptomatic infection. Now, just to remind folks what that means, asymptomatic. So we know that COVID's a little different because you can be contagious before you get symptoms. So we really characterize that more as pre-symptomatic. That's where the contagiousness happens. And so that can happen 48 hours before you actually get symptoms of COVID. So that's really where we see the transmission more so. It's not really people who never get symptoms. That's more unusual. So for that 5% that's getting symptomatic infection, they were contagious for 2 days before they got symptoms.
So I wonder about, we have, of course, obviously our parents have children, their children not have seen their grandparents, been close to them. If the grandparents have had the vaccine, both doses, should they allow the children to give their grandparents a hug, I wonder?
Yeah, so I guess there's no zero risk, right? So it's all about mitigation. So, I would recommend that we still wear masks. Grandma and grandpa wear a mask, the grandkids wear masks. I know with my kids, when they saw my parents, we were always wearing mask distancing. That's just normal precautions. COVID is transmitted primarily by respiratory droplets. It's less so by, close contact and touching surfaces. So, everybody kind of has their own level of risk, but yeah, I would still recommend to wear masks in that situation.
Yeah, I agree.
Mm-hmm.
There has been talk that the second dose that one receives has worse side effects than the first. I think Dr. Pinsky, you made mention in your presentation. Do you want to just talk a little bit more about that?
Yeah, I kind of breezed through that in that very ultra fast presentation, but yeah. So, we have what they call reactogenicity, which is the normal immune response. So, with the first dose, it's not as common. And then when you get the second dose, your immune system has already recognized it. So it's kind of ramping up more. So we see fever occur in 17% of those who are with the second dose. And those are people that are under 65. If you're over 65, that's about 10% get fever. And then chills occurs 48% of the time for people under 65 and 30% for over 65. And I think that was Moderna. And then Pfizer, they had an age breakdown, I think 55 and older. And it was almost very similar numbers in their vaccine trial.
And I think on a personal note, I did my first vaccine. I did have just a little bit of arm soreness, a little bit of a local reaction, and then after my second dose, it was just slightly more intense, but similar symptoms, and maybe a little bit of flushing. But I did not develop a fever or anything like that. But we did experience some of that. In our staff when we did do our healthcare workers at Edward Elmhurst, and but all manageable, and via some Tylenol, ibuprofen, you can manage those symptoms pretty easily.
Yeah, and I've heard people say, that, I got the vaccine and the next day I had a fever of 101, and then the next day they were fine, and they were like, that was totally worth it. I had 1 day of fever, but now I feel protected against getting COVID. So, and you have this sense of optimism and enthusiasm, and it's just a good feeling to have that, have that vaccine kind of behind you. And the fever is really, it's really not serious at all.
And I believe, Dr. Pinsky, in your slides, you said, don't take the Tylenol or Advil before. Take it only if you have the fever. Is that correct? And you want to explain that a little bit more?
Right. Well, two things. First of all, in the phase 3 trial, they did instruct their participants to take Tylenol if they had fever. And so with that, they got the 95% efficacy. So they know that part is safe. And there's been some other studies with other vaccines, with hepatitis B vaccine, for instance, where they actually gave Tylenol before the vaccine, and they found out that they had a decreased immune response. They did the same thing, and they gave the Tylenol only when they had fever, and they did not have that phenomenon. And they did another study in children with other vaccines. So based on that, try to avoid, you shouldn't really take any medications. I've known people who that you have the fever and they're like, listen, I'm not taking anything. This is my immune system. I'm just going to ride it. That's fine if you want to do that. If you feel like you need to take medication, that's fine too. But, you shouldn't be loading up on, ibuprofen, Tylenol, like, round the clock, because you're worried about a fever. That's not a good idea.
Right. Those symptoms are signs of an activated immune system, basically, and it's proof of a positive immune response. So yeah, I agree with John. Not necessary, but if you need to, you can take a dose here and there post vaccine.
How long after I've been vaccinated am I fully protected from the virus?
No, I don't want to use the word fully protected because the vaccine is not fully protective. So it's 95% protective. So if you think about it, if in your community there's a high rate of COVID, that 95% may still translate into some more infections. Versus if there's a very low rate, then the 95% is a higher level of protection. We don't know how long that antibody response lasts. We will get more data. These were through November 27th. So those trials are still ongoing. So we should have more information on that.
Dr. Talley, I've had some questions from patients about the fact that this is that the two vaccines out currently and available are 2-dose shots, and people have asked, well, do I really need the second dose? So what do I do? I didn't feel great after the first one. I'm going to skip the second one, and my advice is to not do that. The data that we have is based on 2 doses. And, really just very, very positive results there at 95% efficacy. So my recommendation would be not to skip that second dose, to do the full course. And that'll provide you with the best safety.
Yeah.
That's a really important point. And the reason is it's 2 doses for a reason. And that's because when they studied it, they found the antibody response with a second dose. You had 10 times the amount of antibody level as the first dose. So, they said, well, we got to give this is a 2-dose regimen. So that's why, they came out with 2 doses. And so really it's, and the side effects, like he was saying is, it's not anything that's serious. No, the exception would be if you had an allergic reaction to the vaccine, then you can't get it, but that's a rare exception.
And thus far, we have encouraged people to, at the time of their first dose, schedule that second dose so you have it on the books and when it is. And then also, the Illinois Department of Public Health has thus far also guaranteed that second dose, so you don't have to worry about it not being available to you.
That's important to know. Thank you very much. You both have talked about when you're vaccinated that you should still wear your mask, social distancing, washing your hands. In social distancing, it's 6 feet. Why that number? Why not 4 feet, 3 feet? What's the magic of 6 feet?
Sure. Well, it's actually not black and white. It depends on a lot of factors, but 90% of droplets don't go more than 6 feet. And someone who's like really coughing, they can get droplets up to 12 feet, right? Mm-hmm. Through normal speaking, it may not go as far. You've heard about these super spreader events where, people are singing and you have people get infected, a lot farther than 6 feet. But it's a good, it's 90% of droplets go 6 feet. So that's kind of where they draw that line.
Fascinating. Very helpful. Thank you. So when do we have any understanding of when we might be at, people talk about herd immunity and everything of that nature. Can you just explain a little bit about that for our audience?
Sure. What herd immunity refers to is when there's enough people in the population that are vaccinated where the virus can't be effectively transmitted from person to person. So they've estimated that. Now, it depends on the effectiveness of the vaccine too. So, and how readily it's transmitted. So those are the factors. Like, so for measles, which, one person can infect 10 other people, you need like 95% immunity, 95% of the population vaccinated to get herd immunity. For COVID-19, it's more like, one person infects 3 people. So it's probably, more like 70%, that need to get vaccinated. It also depends on how effective the vaccine is. If you have a vaccine that's 100% effective, maybe you can get down to 60% herd immunity. But it's the level where you have enough immunity where the transmission starts decreasing instead of increasing.
Mm-hmm.
So where the transmission is less than 1 person. So for every 1 person, there's less than 1 new infection per that person. That's herd immunity.
I think also, the only way to reach herd immunity is through vaccination. We can't reach it through infection. Too much mortality, too much death there. Historically, we've never been able to achieve herd immunity against other infections without vaccination.
Yeah, and another thing about that, when people are getting reinfected, so we've seen in South America where they had a large outbreak that affected 70% of the population in March, and then in December they had another resurgence of COVID-19 infections with a variant mutation, and it turns out that their antibody response was not effective against that virus. So what happens is, if you have more transmission, you're going to have more people immune, but then the virus is just going to mutate and figure out a way to reinfect people. And the vaccine, actually, you get antibody levels that are much higher than natural infection. And they've actually found out that the vaccine-induced immunity can neutralize the virus a lot more than natural immunity. So for that South African variant, for example, the convalescent plasma, these are antibodies from people who've had COVID-19. They tested that against the South African variant, and it did not neutralize it. And then they took antibodies from people who were vaccinated against COVID-19 with the same strain of the virus, and they did neutralize it. So, you get better immunity from the vaccine than you do from natural infection.
So I appreciate what you said there about don't rely on herd immunity and get the vaccination. And that's why I was bringing it up. I really wanted to have you let people know the necessity of getting the vaccination and not waiting for this herd immunity, because that may not come about, and it won't come about until we have a large percentage, 70, 80, 90% of our people vaccinated. Thank you. So we have a few more minutes. I want to ask you, just where do you recommend that people go for best information on COVID-19 vaccines?
Well, the CDC is a great resource, and they update information. Yesterday they updated something. Anytime you hear something in the news, usually there's an update on CDC about it. That's kind of the first place to go.
Yeah, I would agree. And then, your primary care provider, you can always ask questions. Your local infectious disease doctor as well. We have information on Edward Elmhurst Health website, as well as all the other local health systems do as well. But most of that information we get from the CDC. And you can also get information from your county health department website as well, and also the Illinois Department of Public Health website.
Yeah, and I think on the Edward page they have some links to resources to get more information.
Correct. Yeah, it's all kind of under a vaccine website.
Right. COVID
and
site on the web page. Yeah.
Correct.
I know that the DuPage Health Department has information on their website as well. I know people can sign up to get information, especially about the vaccine. And so I keep telling people to go there. I'm glad you mentioned about Edwards Hospital and where they can go to get their information. That'll be very helpful. One really, I guess, one final question. Your local doctor, when might we expect that they will have the vaccine available for them to give to you? Is that something in a few months? Is that something maybe not until next fall? Or is it available now?
It's a great question. So currently we're doing mass vaccination sites. So one in Downers Grove and one in over in Woodridge. And partly that's related to the storage of these two vaccines. And the advent of the Johnson & Johnson vaccine could potentially make that process a bit easier for us. We're also a bit more efficient doing that way. We're strictly focusing on vaccinations rather than kind of interspersing it within our visits on a daily basis in the offices. It will be available at some point. I don't have a great estimated date to give you where it will be physically in your primary care physician's office. But that day will come. But at this point, we're doing it kind of in mass at those two sites.
Yeah, I would find it hard to believe that most family physicians have the storage facility that will keep things at minus 80 degrees. And
that's
so
right.
I understand how that would be difficult.
The other thing is that the vaccine, it comes in it's a multi-dose vial. So, the Moderna, I think it's 10 in a vial, and Pfizer, you can get about 6. So that means you have to, for the Pfizer, if you're going to have that, you have to have 6 patients in your office getting the vaccine. You can't just kind of say, oh, you want the vaccine, you're in the office, and you're going to end up wasting vaccine, which we absolutely don't want to do.
That's right, which we want to avoid. Yeah.
So I'll give each of you a minute or two to give any final words about the vaccine that you feel that our audience should know before I bring this to a close.
Well, I would just encourage everyone to, get the vaccine as soon as it's available to you. Like Adam was saying, that that everyone in this country will be able to get the vaccine. It's just we can't all get it at once. So we just want the line to move quickly. When it's your chance, get this, and hopefully, there is hope for the future, and we could get back to normal, and if we're all in this together and we all get vaccinated, and we can do everything we're supposed to mitigate the spread of COVID-19.
And I would echo that. I think the science is there. It supports getting these vaccines. The safety data is there as well. And agreed. I would recommend that everyone get it when it's available to them. I would also recommend doing that with some patience as well, as this is an arduous process, and there's a lot of people to vaccinate, but it will be available to everyone at some point, and to do it when it is.
Wonderful. Well, this has been a very informative discussion, and I want to thank you, Dr. Schriedel, and you, Dr. Pinsky, for coming tonight and sharing your vast knowledge about the vaccines. Thank you to our viewers for attending this evening. We will have information on our homepage that includes the link to this presentation on the district's YouTube channel. And with that, I will say good night to all of you. Thank you, stay healthy, and keep moving strong.
Thank you so much.
Thank you for having us.